Hi, I'm Dr. Paul Lorenson, Medical Director of the Neighborhood Christian Clinic. How many times have you evaluated a patient with headache, fatigue, or insomnia, and after a complete assessment, you sensed their problem was not rooted in an organic medical problem such as a brain tumor or hypothyroidism? Their exam and lab work were normal, and something about the way they were carrying themselves suggested that there was more to the story. As a Christian healthcare professional, you know that God has created each of us with a physical body, but also with a mind, will, and a soul. You sensed that the patient may have had a problem in one of these other areas, but you weren't sure how to go there. We want to encourage you to take that next step and have developed this program for you. This curriculum is designed to help you assess and treat the whole patient, to have the ability to go beyond treating physical illness to caring for people with spiritual needs. Additionally, we want to make sure that nothing stands in the way from your engaging in the care of the whole patient. This program will help you move past many of the obstacles that some believe prevent them from discussing spirituality and religion with their patients. For example, maybe you're not sure if spirituality has anything to do with physical health. Or you don't think the average patient sitting in your exam room believes in God or wants prayer. Maybe you practice evidence-based medicine and you don't know if there's any evidence that spirituality can improve health. Or you have decided that faith is relevant to health, but you think that accrediting organizations or governmental agencies did not permit you to discuss religion with your patients. Maybe God has convinced you that He plans to build His kingdom through the church and specifically through you, but you have no idea where to start or how to break the ice spiritually with your patients. The program you're about to experience will address each of these issues. We will discuss the connections between healthy bodies, minds, and spirits. We'll examine the evidence for the impact of healthy spiritual lives on overall health. We'll discuss whether it's possible to discuss spirituality in an ethical manner and look at what accrediting agencies have to say about it. For those that are ready to move forward with whole patient care, we'll give you practical tips for how to engage patients in spiritual conversations and how to involve your entire organization in spiritual care. Finally, we'll make sure that we address self-care for healthcare professionals that engage in whole patient care, knowing that following God's call to share your faith can lead to spiritual attacks. If you invest yourself in this program and ask God to use it to help you grow in your understanding of His plans for you, many of your questions will be addressed and you'll be equipped to move forward in delivering spiritual care to your patients. Regardless of whether or not you are a student, practicing professional, or an administrative staff member in a healthcare organization, God wants you to give this area of your life as a service to Him. Join us as we look at how the Christian healthcare professional can engage in spiritual care in the healthcare environment.